All right, listen to this. There is an epidemic of misdiagnoses when it comes to hypothyroidism in this country. And our next guest wrote the book on it. It's called Hypothyroidism, Health and Happiness. And welcome, Dr. Stephen Hotze.
Jerry, thank you so much.
It's nice to meet you. And I got to tell you something. We're talking about, this is epidemic proportions of misdiagnoses. Isn't it?
Right, it is. And let me explain to you what hypothyroidism is. Hypothyroidism is a lack of adequate thyroid hormones within the cells of your body to enable your body to function. Now, the thyroid hormones are what enable your cells to produce and use energy. So if you don't get enough thyroid in your cells, whether it's because you don't have a thyroid gland because you had a problem with it, or because your thyroid gland's not adequately producing, or because you have some resistance at the cellular level from getting thyroid in your cells. If you don't get enough thyroid in your cells, your body runs sluggish and you don't feel well.
So what are the symptoms of hypothyroidism?
Obviously, if you run sluggish, you're going to be fatigued, tired.
But people often think that's something else.
Right, well, they do. But the most common cause of that, of course, is low thyroid. So it's fatigue, difficulty with weight, inability to think clearly, brain fog, moods, depressed, panic attacks, anxiety attacks, insomnia, joint and muscle aches and pains, loss of romantic moods and inclinations.
As he leans in, loss of romantic moods and inclinations.
So
that's a big
deal.
Part of it,
and
sure.
then stomach disorders, recurring chronic infections. Women have irregular menstrual cycles. It's there's a host of symptoms, okay, which seem unrelated, but there's a strand that connects, and it's the lack of thyroid in the cells. Now, here's the problem. And it occurs in women 6 times as commonly as it does.
But can occur in men.
It does, but 6 times more commonly in women, and that's because of hormonal changes that occur during menstrual cycles. What happens is they go to their physician saying, I have all these symptoms. And the physician looks at them and goes like, well, and she says, I think it could be hypothyroidism. I read it in a book, I saw it in a magazine, I went online, and would you check me? He goes, you don't have hypothyroidism, I'll prove it to you. And he'll do a blood test. It'll come back. Tell me, ladies, it comes back normal all the time. It comes back according to the doctor, but the range of normal is so wide and so broad that everybody falls within the normal range.
So what do you ask the doctor then if you think you're having this problem?
You find it, what you do is you have to find a doctor that will treat you based upon your clinical symptoms and give you a therapeutic trial of thyroid. Because this is what the doctor will do, Jerry. He'll say, it's normal. You need to be on antidepressants. So the women get on antidepressants, anti-anxiety medication, sleep medication, pain medication. They get drugged up on all these drugs, and it changes their life. So it affects their work, their spousal relationship, their family relationship, and their confidence.
So how is your approach different? What do you do differently?
Well, what we do is we treat based upon clinical symptoms. We also check for antibodies to the thyroid gland, which most doctors don't. So about 30% of the women we see have antibodies to their thyroid gland. That means they're attacking their own thyroid gland. That's usually not checked by conventional doctors. And then if they have symptoms of thyroid, we're going to give them desiccated thyroid. We're not going to put them on synthetic thyroid. And the reason we don't use synthetic thyroid is we find it doesn't work near as well as natural thyroid.
All right, well, Dr. Hotze, this is really incredible and enlightening information. Thank you very much. If you'd like to speak with a new guest consultant today, you could find out if Dr. Hotze and his Hotze Health and Wellness Center is a good fit for you. You can call the number on your screen right now, and that's 877-698-8698, or you can log on to hotzehwc.com. Be right back.